answer your questions and to increase our community overall. So we'll be beginning with most commonly asked questions from rhinoplasty patients, and we'll be getting the opinions of Dr. Emrah as well related to this craft. I hope you keep in mind that we are always here to support our patients, and this is just a brief summary of the general questions that we may be receiving from patients all over the world. Again, we're always able to provide video calls with Dr. Emrah for a one-on-one evaluation with the patients before moving forward with a booking or a reservation as well. So first, I'd like to get started on how our case evaluation process works, specifically here at Clinichub. So when a patient applies for rhinoplasty, we provide them the initial details on what most of them ask is obviously the pricing. But more importantly here is to understand what the patient exactly wants out of the procedure itself. So that's what we're going to go over with Dr. Emrah as well. So beginning with case evaluation process for rhinoplasty patients. Overall, there are various categories that a patient can be determined into, which also affects both the pricing of the procedure as well as the duration of the procedure and the complexity of the procedure itself. So we'll be going over Caucasian rhinoplasty, ethnic rhinoplasty, revision cases, and most importantly, complicated cases. So number one, when evaluating a patient's case, what we need from the patient themselves is their photos. They need to fill out a medical form, and we need to collect approximately 2 to 3 wish photos from the patient as well. The reason we ask for wish pictures specifically is when evaluating your specific case, we want to determine what you want out of the procedure. So let's go over them one by one, speaking about Caucasian rhinoplasty first. So sir, when we send over the pictures and the medical form for a Caucasian case, what are you looking at exactly?
Yes, generally, primary Caucasian nose is they have little bit small bump, moderate skin, not too thick, not too thin, and generally straight, not so crooked nose, and not so droppy. Again, generally our is classified primary Caucasian nose.
Okay. So in terms of a primary Caucasian nose, what is the patient expecting the surgery duration to be? How long will the surgery take?
Generally, 1 maybe 2 hours maximum,
Okay.
and the healing is so faster other
Mm-hmm.
than
Mm-hmm.
and is advantage
So
for
between
them.
each of the categories, primary Caucasian would be the most simplest, the easiest surgery
Yes,
out of the other
exactly.
options.
Yeah.
So how can a patient who is a Caucasian nose be considered complicated, for example?
Is especially is crooked nose, because crooked nose we have to change every anatomic part on the nose, and a big bump and thick skin, because thick skin moderate is a little bit difficult and hard, and take expirations, and asymmetrical nostrils, sometimes take sometimes it's take fix it takes time, 1 hour,
Yeah.
and droppy nose, and maybe filler or
No
thread
threads.
lift,
Mm-hmm.
applying. Patience is so
Mhm.
important,
Mhm.
because it's damage their
Mhm.
skin,
Mhm.
and we removing while removing filler or thread, it is also dangerous,
Mhm.
and of course surgeries longer
Mhm.
than primary Caucasian.
So overall, patients need to understand that any procedures they have done to their nose before, which includes fillers, which includes nose threads, or anything, septoplasty as well, if you're moving forward with a rhinoplasty surgery, then this is going to affect the duration of the surgery you're having, and it's going to affect the category of your specific nose. It may be determined as a complicated primary rhinoplasty. So within this, you have to understand that any patients who do have fillers, even non-surgical ones like fillers and nose threads, this affects the general structure of your nose, as well as it can have damaging effects on your skin, which will in turn affect the rhinoplasty results as well. So obviously, we're working with an expert in the field. We have done many rhinoplasty cases where patients have done fillers, where patients have done nose threads, and they come to us for a rhinoplasty or revision rhinoplasty procedure as well. So between Caucasian, what we can understand that when determining and evaluating your case, we look at the general anatomical structure of your nose. We look at any bumps that may be in the nose.
Big bumps, especially big bumps.
Yeah.
So important.
We also look at any past procedures that you have done, as well as looking at what you're expecting out of the nose. So for a Caucasian person, for a Caucasian primary patient, out of their expectations, what can they expect to have the results of the specific surgery itself? Do you think that Caucasian patients have a more realistic expectation, or do you think generally, since it's a more easier case, they have very high expectations?
Yes, generally is depend on ready for health mentally.
Yeah. So you have to be mentally ready for the
Yes,
procedure
so
itself.
so important. And after the operations, patients should be patient.
Yeah.
Because final shape is not we never get suddenly.
Yeah.
Post-op long periods.
Yeah.
It's very important.
So specifically to rhinoplasty, obviously, a lot of patients expect an outcome the day after the surgery. Obviously, they will see a change right after the cast removal. Most patients are shocked at what the results they received at, and they're happily going home. But you have to understand that this is a long-term surgery result that we're looking for. Generally speaking, it's up to 1 year for the healing period of most of the categories. For primary Caucasian, we can say that you can expect your final results within 6 to 8 months.
Yes, 6 8 months.
Yeah. And what about complicated Caucasian patients? Would they look at 6 to 8 months or
a little
more?
bit longer as probably 1 year is we will get final shape.
Yeah. So it's important to be patient here,
Yes.
obviously, and to also, what we'll be reviewing later on, is to follow your post-operation care routines as well. So let's move on to ethnic cases then. Primary ethnic and how it can be determined if it's a complicated procedure as well. So regarding ethnic rhinoplasty, can you give us a detail on how it differs from Caucasian and other details as well?
Generally, these patients have not nasal dorsum. Nasal dorsum so low, and we need augmentation nasal dorsum, and they are generally ultra thick skin and droppy nose sometimes, and wider alar rings and big nostrils. Uh, Augmentations and for creating new nasal dorsum, supporting tip, and reshaping nostrils and reduce alar wings is takes times 2 maybe 3 hours. Therefore, a little bit harder than primary.
So ethnic cases for the surgery duration itself is going to take longer than a Caucasian case.
Yes, and for augmentations and supporting tip, we sometimes use rib cartilage because rib cartilage is strong cartilage more than septal cartilage.
So that's one of the main questions we get from ethnic patients. Will the doctor use rib cartilage for my nose or will they not?
If the patients have a nasal dorsum genetically, sometimes we don't need rib cartilage. Is depend on the septal cartilage stronger. If I came out stronger cartilage inside nose, is enough for us. But sometimes we have to support septum, septal cartilage, right and left side in septal cartilage supporting, and uh, reshape tip of nose, we need rib cartilage.
Yeah. So what we're going to be evaluating here is obviously pictures that you send. But the end result, whether we need to use rib cartilage or not, is going to be determined in the operation theater when we open up the nose to see if your septum cartilage is enough to actually augment the bridge and support the nose tip as well. So in terms of ethnic patients, rib cartilage may be required. And again, let's move into a question that ethnic patients generally ask. Where is the rib cartilage harvested? How is it collected? And how is it shaped to be added to the nose?
We perform right under breast 3
Mhm.
centimeter incisions,
Mhm.
and we remove fascia and rectus muscles fascia, and remove rib cartilage
Okay.
and rib cartilage, and dice and reshape,
Mhm.
and if need supporting area, we will put and fix it.
Okay, and do these patients expect any pain after collecting rib cartilage?
Not too much, because we don't cut their muscles. Just maybe 3 days, uh, a little bit pain.
Yeah.
Yes.
So depending on your pain threshold, especially if rib cartilage is used, you can expect around 3 days of discomfort. Again, with our package, you have to understand what we provide for you. Specifically for rhinoplasty, generally, we provide 7 nights of accommodation. So one of those nights are going to be in the hospital, the night of your surgery itself, or the day of the surgery itself, and the remaining 6 nights will be back at the hotel that we're contracted with. It is a 5-star hotel. You are able to bring your companion with you as well. But the most important thing here is in the hotel that we're contracted with, we provide 24/7 nursing care as well as post operation doctor care. So even when Dr. Emrah, after he provides his surgery with you, we provide you the transfer back to the hotel and we monitor you. If there is any discomfort that you're feeling, our nurses will be checking on you daily to provide you care. Our post-operation doctor will be providing the details over to Dr. Emrah as well. So you'll be taken care of throughout your entire stay. So this is very important because a lot of clinics all over the world, as well as in Turkey, also provide this um, specific service, but you have to understand that we're actually licensed to provide this specific service. So all of the nurses, all of the post-op doctors as well are certified to provide you the care for this treatment itself. Okay, this is very important. Having the licenses and being audited for this is something that patients really do need to consider, because alternatively, if you go to a clinic that is not licensed to provide this, the care that they may provide may not be adequate for the treatment that you're specifically having. So we talked about Caucasian rhinoplasty, we talked about ethnic rhinoplasty, we talked about collecting rib cartilage for ethnic rhinoplasty. Let's talk about revision a little bit. So we have patients all over the world who have rhinoplasty. They're not satisfied with the results sometimes, and they want to come to us to provide the revision rhinoplasty. So how do we determine if a patient is suitable for revision? What do we look for?
Revision rhinoplasty is also different, because their anatomy is damaged before and or change before surgery. Sometimes some revision just have a little bit bump, we will remove easily and close rhinoplasty. Sometimes we have to change every anatomic parts. And when I open the nose, if I couldn't find any harvest cartilage, strong septal cartilage, we have to use rib or rarely ear cartilage. Just one piece is cartilage enough. Is sometimes I use ear cartilage, but I don't recommend ear cartilage, because ear cartilage is so weak, and shape is anatomically curved, not strong.
Yeah.
If we have to beautiful result, we have to use rib cartilage.
Yeah.
Cartilage is so advantage for us.
Yeah.
And revision case is sometimes we change cartilage structure, scalation. Sometimes we change nasal bone structure and supporting empty weak areas, and that's all.
Yeah. So revisions are always more complicated than primary surgeries. Number one, with every revision that you may want to have, even after your primary rhinoplasty procedure, the results you'll receive at the end will always be minimal, depending on the patient's case, of course. So we also, Dr. Emrah just clarified why we recommend rib cartilage. Ear cartilage is something that most patients ask us as well. Instead of rib cartilage, can I use ear cartilage instead? We always recommend moving forward with rib cartilage. The reason why is because ear cartilage is its elasticity is higher than rib cartilage. It's curvy and it doesn't have the strength enough to support, especially the tip of the nose.
Yes.
So considering all of these variables, using rib cartilage at the end of the day will provide you both with better results and it'll be safer for the treatment itself in providing those results. So revision rhinoplasty, it's something that we do provide. It's something we are experienced in as well.
Yes.
If you are interested, you can always send your photos and your medical forms to our coordinators. Dr. Emrah can review your case to see if revision would be the right option for you.
We want to support especially tip of nose. We have to need straight cartilage. Just we can harvest two areas, one septum, second rib, and septal cartilage damaged before surgery. Therefore, we use ribs cartilage.
And we can only know that when we actually open up the nose to see what we're working with. Again, with revision rhinoplasty, if we only look at your pictures, it's generally not enough to understand what's hidden inside of the nose. So for revision cases, even some primary cases as well, once we open up the nose, we're able to determine what the anatomical defects of the first procedure was so that we can better specifically design a surgery based on your needs. We can check if the septum cartilage is enough as well.
Yes.
If not, then we can move forward with collecting rib cartilage to, again, provide a better result overall. So moving forward, we'll go into rhinoplasty surgery techniques. And there are various, marketing around every specific technique all over the world. What we generally recommend and what we use is the piezo technique. So we'll get into what piezo is, why we provide it, why we recommend it overall, and why our surgeons, especially for rhinoplasty, are moving forward with the piezo method. So number one, sir, what is piezo?
Piezo instruments are using piezo instruments for reshaping nasal bone. I have used for 10 years. Piezo instruments sometimes advantages for us. Firstly, we have to stay in safe zone.
Safe zone, yeah.
It's so important, and we can prevent unexpected cracks, and we can protect nasal under tissue, under nasal bone tissue, and therefore we cannot see, we don't see bruises. It's an advantage for us, and healing process a little bit
shorter than normal.
Yes.
So again, just to summarize everything, the reason why we move forward with the piezo method is again to basically stay in the safe zone. Doing dramatic changes to a nose overall with any surgery that you may have is going to cause either increase the complication risks overall or to provide you an unsatisfactory result. Staying in the safe zone is always, again, within the name, safe. So complications are always an issue with any surgery that you may have. You can walk into a hospital right now and you have complication risks themselves. So with the piezo method, again, you may have read it online, you may have heard it from other surgeons. Bruising is significantly reduced with the piezo method. We're able to control and maintain the cracks that can form within the bone structure of your anatomical structure, and we're able to most significantly provide protection and significantly reduce the risk of damaging the tissue underneath the bone of the nose overall. So would we move forward with piezo for every case, or would it change for Caucasian? Would it change for ethnic, or is piezo okay for Caucasian, ethnic, revision, everything?
If I reshape nasal bones, for example, nasal bones so irregular, so asymmetrical, so wide, we use piezo instruments, ethnics, primary, Caucasian, revision, doesn't matter.
Yeah.
And this advantage is when I open your nose, if I blocked any hard tissue, for example, osteum, for example, nasal bone, I can remove and I can reshape easy.
Okay, so that's also a significant point here to understand as well. If we come across any unexpected specific bone bumps or stuff like that during the procedure itself, with the piezo, we're able to again shave off that area and maintain the overall harmony of the nose and provide you a suitable result that you'll be happy to live with. Again, talking about harmony. So there are patients who send wish pictures, obviously, but the wish picture they send may not be suitable for their specific face. So when we're evaluating patients' photos, when we're looking at the wish pictures, we need patients to understand that a wish picture that they may have may not be suitable for their face. Okay, so harmony for the face overall, no structure. What should patients understand when looking at wish pictures or when looking at noses on social media, on Instagram, on Facebook, everything like that?
This is profiloplasty is so important for this. Is we shouldn't focus on just nose.
Yeah.
Never.
So the entire face,
Yes.
everything.
For example, if patients have a round face, we so slim nose is not suitable for their face. For example, long face, too short nose is not suitable face.
Yeah.
It's so important, and thick skin type of skin is limited us.
Yeah.
It's so important. For example, ultra thick.
So patients who have thick skin can't have too small noses.
Yes. To ultra thick skin is, we can try is smaller is not suitable. Is not harmony tip and between tip and nasal dorsum is cannot get is harmony.
Yeah.
So important.
Yeah. So overall, you have to understand that it's not only your nose, it's your entire face. So we need to provide a result that's suitable for your specific face. We're looking at, obviously, our faces are naturally asymmetrical. Even after rhinoplasty, it'll still be asymmetrical to a degree, no matter which rhinoplasty surgeon you choose. Our focus will be to provide you a nose that fits your face while protecting the overall harmony of your facial structure as well. So moving forward, we'll be discussing preparations for rhinoplasty. So what is a patient expected to do pre-op rhinoplasty? What is the patient expected to do post-op and even during the surgery itself? So right now, if you'd like, we can begin with pre-operation. What should a patient do to prepare themselves for rhinoplasty surgery?
Firstly, they should be ready for operation mentally.
Mentally.
Yeah. Secondly, we cannot some get some herbal tea or get they should protect infections. Infections so important. Never drink alcohol. It's so
Alcohol and
important.
Smoking is
Smoking,
definitely,
never.
you should stop because it will affect your healing as well after
Yes,
the surgery.
build hormonal build birth controls
Okay,
pills is
birth
important.
control pills
Yes,
should be
pills.
stopped 1 month
Yes,
before the surgery, or how
yes,
much?
enough for
Okay,
us.
okay. And how about controlled, like spirals or implants? Is that
Don't.
okay for the
Yes,
surgery?
okay, no problems.
Okay, so
Never
you
affect
can
us.
basically, as long as you stop birth control pills,
Yes, of
as long
course.
as you stop smoking, as
Smoking.
long as you stop alcohol consumption, and herbal teas, specifically due to blood related issues, all of these you can stop 1 month before. But for any spirals that you may have used for, again, that's for birth control, but what we're talking and referring to when stopping birth control is the pills, obviously, and any arm implants that patients may have for, birth control. Again, those are all fine. You do not have to remove them for the surgery, but it is important for you to tell us that during your medical form so that the doctor can check to make sure that what you have is suitable for you to move forward with the surgery. Again, talking about pre-operation, we talked about how a patient should be mentally ready.
Yes.
So can we clarify, what should a patient expect to be mentally ready? How can they know that they're ready for the surgery? Is it based on expectations that they should have, or
So
mindset?
expectations must be realistic.
Yeah.
Generally, patients have thick skin,
Hmm.
wants to smaller nose. It's impossible.
Yeah.
We have to tell.
Yeah.
We have to get informations.
Hmm.
And some patients want to too high nose
Yeah.
is, but they never want to see front sizes, not stills. It's
Hmm.
impossible. We have to tell us. Tell them.
We actually have a question from one of our patients. They said, can we take Amica and bromelain before
Bromelain, yeah.
surgery?
It's important because bromelain is
Is it okay for them to use before
yes.
surgery?
Generally, I use after the operations, but
Mhm.
sometimes if I can, if ultra thick skin,
Mhm.
we can give before surgery 3 days.
Okay.
Yes,
Okay.
and it's help go down swellings more faster
Okay.
and healing process a little bit
Mhm.
long, shorter.
So I'd like to remind everybody that we are seeing a couple of questions going around the live chat as well. We'll try to get to all of the questions as much as possible. First, let's just go over all of the structures so that we have the questions answered as well. So we were talking about mentally being ready for the surgery.
Yes.
Expectations is very
So
important.
important. Yeah.
If, for example, a patient who has a wide nasal area and thick skin wants a very small nose, it's not realistic. They can't achieve that nose. So it's important to be realistic and understand what's possible for you specifically. The way we help with this is, after reviewing your case, we also request a summary of exactly what you want for the rhinoplasty. Why do you want a rhinoplasty? The reason for this is because the doctor tries to understand your specific mindset and what you're looking to get out of the procedure. Rhinoplasty is not a suitable surgery for everybody, and we're probably one of the only clinics who provide transparency to the patients. If you're not suitable for the surgery, or if we think you will not get a result that you're asking for, we will tell you this. And we will also, if you'd like, have a video call to understand what you're trying to get out of the surgery and to help you understand what's suitable for you exactly to provide. So mentally being ready for the surgery itself is very important. Not looking to get a nose of somebody else for you is very important. So being realistic overall is very important.
Yes. Every wish knows not suitable their face maybe.
Yeah.
We can calculate and assess everything,
Mhm.
and we can decide.
Mhm. Mhm. So we talked about pre-operation. let's talk about the surgery day. When the patient is here, they go to the hospital. The morning of the surgery, they have a physical consultation
Yes.
with you. What can they expect out of the consultation? How does the consultation move forward?
Generally, first question,
Mhm.
what's your main concern about nose? They
Mhm.
generally they ask for changing,
Mhm.
and they show me wish
And they're
photos.
excited, nervous,
Exactly,
showing you wish
nervous.
pictures. Yes.
Yes, and that's all.
So you talk about what
Yes,
they're expecting out of the
expectations.
surgery. You
Yes,
tell them after the physical consultation approximately how long their case may take for surgery. And obviously, your tests are done the day before. You will also be expected to have a consultation with the anesthesiologist to make sure that your
yes,
blood levels are correct and you're healthy and suitable to move forward with the procedure itself. Again, this is very important. Overall, staying in the safe zone and related to your blood test results. If they're not suitable, if your hemoglobin levels are very low, for example, it can be an issue. So that's why we recommend every patient to provide us tests 1 month before the surgery. Thyroid tests, CBC test, which is complete blood count test. These are very important. If you're able to take these tests in the country that you live and provide us the results, Dr. Emrah will review and provide you an insight on whether you're okay to move forward with the surgery overall. So what about post-rhinoplasty? Right after their surgery, they're discharged from the hospital after having the consultation with you as well. Then we collect and move you to the hotel. The hotel, you'll be monitored again by the nursing team as well as the post-operation team. But what's most important here is post-operation rhinoplasty routine. So again, massages, I believe,
massage,
bandage
taping.
tapes. So
Yes.
can you explain a bit about that process as well?
Generally, we will remove cast after 5 days, and then
5 days after the surgery.
yes, and then I will tell new massage techniques
Mhm.
and taping,
Mhm.
and then I will put new cast on your nose. They
Mhm.
will stay generally 7 days.
Mhm.
After 7 days, you they can take it off
Mhm.
themselves,
Mhm.
and then they starting doing massage.
How many
And
months do they have to do the massage after rhinoplasty, for example?
depend on healing,
Mhm.
depend on their healing.
Yeah.
If their skin is so loose,
Mhm. Mhm.
maybe 5 times a day.
Mhm.
Sometimes 3 times a day enough
Mhm.
for us.
So it
And
depends on the patient's case.
yes, after 1 month,
Mhm.
I will assess again. Maybe change the massage, maybe stop massage
Mhm.
is enough for us.
Mhm.
Massage is so important because there is a gap after the operations
Mhm.
between the skin and scalations.
Yeah.
I will, for healing properly,
Mhm.
we have to do press,
Mhm.
and massage is so important.
Yeah. So again,
Uh,
just to clarify here about something that Dr. Emrah said, even after you return back home, we will be in touch with you, following up with you to see how you're healing. Generally, for patients who are having rhinoplasty, patients send their photos to Dr. Emrah and to Clinichub, the coordinators, the post-operation
yes,
team, every month to see how your healing is moving forward, if we need to change anything related to your post-operation routine. So maybe if you're healing very rapidly, we may reduce the massages that you need to do. But the post-operation care leading up to the first 1 year of your surgery is very important. So this has to be strictly followed up. The surgery itself is only 2 hours. That's done and then it's fine. But leading up to 1 year for your post-op routine, you have to be strict about
yes,
it.
it's also important because we if we get a beautiful nose,
Mhm.
we have to some instructions properly after
Yeah,
the operations.
to protect it,
Yes,
to
protect
keep
sunlight,
results.
protect damage, protect infections.
Mhm.
So
Mhm.
important
Yeah.
for healing,
Mhm.
and the massage and taping is so important.
Mhm.
Uh, Generally, I recommend cannot use glasses for 2 months. It's so important.
So can't use glasses for 2 months. Okay.
Yes, because it's press
Yeah, pressure
there's
on the
pressure
nose.
on the nose,
Mhm.
pressure on the nose, and maybe nasal bones is more than slimmer.
It gets more narrow.
Yes,
Yeah.
change the shape of nose. And
What about exercise after post-operation?
if I use if I don't use rib cartilage, generally 2 weeks they can do
Light
gym,
exercises. Okay.
jogging, swimming.
Okay. So we've had patients before who also do boxing, for example. How long after rhinoplasty, or even if they can do that?
I never recommend, but
Yeah.
after 1 year, maybe they can do.
So you have to keep in mind that after rhinoplasty, especially right afterwards, your nose is like clay. It's very soft and it's delicate. In order to keep the results and in order to have a successful rhinoplasty, you should understand that you should always stay away from traumatic exercises such as boxing or heavy sports like heavy weightlifting or soccer or examples such as those. Again, you should try to protect your nose daily. Make sure that you don't get hit for any reason. Just be more careful overall. Obviously, we'll be instructing you about your daily routines when you're here as well. But generally speaking, I believe every patient would understand that they should be safe after the rhinoplasty. So we talked about pre-operation care, we talked about your surgery duration here, we talked about post-operation care and how it's basically scheduled based on the patient's needs. I would also like to clarify that we'll be with you throughout this journey. So leading up to 1 year or even afterwards, we'll be following up with you with our team. We'll be providing your pictures to Dr. Emrah for him to review once more. Maybe he'll give us information on changing your routine for your post-operation care. So you won't be left alone after you leave us or after you leave Istanbul overall. You'll have our contact information ready and available 24/7 whenever you need us. So moving forward, we talked about also the post-op routine as well. Recovery process generally. Is it always up to 1 year for any patient, or are we looking at more complicated situations where the final result can be maybe 1.5, 2 years?
3 years, maybe.
Yeah.
Is depend on genetical response for surgery, and I mentioned
so every patient is different.
Yes, every patient is different.
Yeah.
The gap is so important.
Yeah.
Because when I look to mirror, I can see just our skin, our skin cover, or scalation. Yeah. Even if we properly beautiful scalation, but it's cover skin. Therefore, skin healing is very important.
Yeah.
And
so you can think of it like a tablecloth on a table. So we can shave the table and structure it however you want, but on top of it, the tablecloth still remains. So in this example, it would be your skin. We can't reduce your skin. We can't make your skin more thinner, obviously. So we need to work overall with a balance of the thickness of your skin, your skeletal structure, and to provide a surgery for your specific case. So moving forward again, let's look at some of the daily work routines that you might have. This is one of the questions. Also, I just remembered now, what about nose retainers? Many patients also ask about retainers and post-operation care with the retainers.
Yes, I generally use retainers because our tip of nose is somewhere is cartilage.
Okay.
Somewhere is just skin. We have to support skin while healing. It's so important. We can try as much as possible symmetrical nostrils, but for healing is supporting. Okay. Therefore, I use retainer.
So how do patients use retainers? Is it the whole day? Is it when they're sleeping at nights?
If they have symmetrical nostrils, just use night. Just night is enough for us. But some people is memorize skin memorize, and therefore nostrils looks like symmetrical. Generally, I use 3 months as much as possible.
Okay.
use. The more use it, the better. And generally, maximum use 6 months for complicated revision.
Okay, okay.
Rhinoplasty.
So again, you can think of that like memory foam. We want to keep the structure of the nose. So nose retainers are generally used for patients. If it's a simple case, then it could be for 2 months. Again, like the doctor said, it can be done when you're sleeping. So you can put in the nose retainers at night, for example. But for more complicated cases, you may need to use the nose retainers for a longer period and to use it throughout the day as much as possible as well.
Yes.
So before we move forward with questions from you patients as well, let's talk about something that, again, our final structured question here. Will the results be permanent? Again, the goal we have here is rhinoplasty should be a one and done procedure. So obviously we're not looking to provide you revisions or complicated revisions after your rhinoplasty procedure. We want you to get the best results that you possibly can and to provide them for long usage. So what that means is lifetime, basically. Again, Dr. Emrah is an ENT surgeon, meaning ears, nose, throat. So breathing, number one, will not be compromised for beauty. We will always make sure that you have your breathing issues fixed as long as it's possible within rhinoplasty as well. Again, we have to open up the nose to actually understand that. But breathing issues need to be solved. Beauty is second. So we need to fix all of those issues first. So in terms of results being permanent, what can patients understand about this question, for example?
Now, of course, our goal is provide long
Yeah.
time or special lifetime if don't have any problems.
Yeah. So aftercare routine is very important here.
Yes.
Following up with us, even after 2 years of your surgery, you can contact us. We can make sure that you're still healing properly. And depending on your case, your results may take a longer time to actually heal. So we can begin with a couple of questions that are submitted from our patients as well. So I'm receiving those right now. So piggy noses. What is piggy nose, for example?
Piggy nose generally is after the surgery. If surgeon lift too much nose, this is piggy nose. Looks like piggy.
Yeah.
Is a little bit complicated. We have to second. We have to revision surgery. We have to do revision surgery. As revision surgery, our aim is longer nose and reduce tip of nose and fix it as much as desired level.
So we also have a patient who says Dr. Emrah is a magician. He made my nose in November. So one of your patients from November. She says that thanks a lot for everything, obviously. 2 months post-op, Dr. Emrah performed my rhinoplasty. My nose feels very stuffy. What can I do to prevent this? So she says that her nose feels stuffy right now. What can she do to help with that situation?
It depends on a lot of reasons. For maybe swellings inside your nose, maybe allergy, maybe sinusitis. We can check inside their nose and maybe fix these problems. Sometimes I use nasal straight sprays. Sometimes use just massage. Sometimes maybe use antibiotics.
Okay.
It depends on the reason.
So we'll have time for one last question because it has been 40 minutes since we started. Obviously, right now it's 1:40 a.m. here in Istanbul. So, in fact, yeah, we have a question about weightlifting. So one of our patients is weight training. So she's a heavy lifter or he is a heavy lifter here. How long after the surgery can they go to weight training? Ağırlık çalışma hocam.
Weight training is if
heavy.
Yeah. Every 3 months, they can.
So
lift.
a minimum of 3 months would be required or recommended for you in this case. And I also just received word that we also have a hidden discount code here that we can offer any patients who are actually watching and joining us here. As one of the first in many interviews we'll be having with various doctors here in Clinichub, first of which is Dr. Emrah. If you provide your coordinators with Live 200 code, we'll be able to provide you a discount on your upcoming rhinoplasty procedure. So keep that in mind. You can text your coordinators right now. You can reach out to us at clinichub.com as well. You're able to reach us from WhatsApp for a faster form of communication. If you prefer email, you can also reach us at info@clinichub.com. We'll provide you a coordinator and we'll provide 24/7 response to you. So, sir, thank you for your time. Thank you for answering our patients' questions. Hopefully, we can do this more often and increase the size of our community, because a lot of these patients have questions that they would like to get the answers from the doctor directly. So again, thank you for your time. Thank you for joining us.